Last question was, that's all right, Dr. Pickett. Based off the evidence that you reviewed, her journals and scratchbooks and interview with other children, family, and friends, you determined that she exhibited some manipulative behavior. Next question.
Dr. Pickett, we were discussing the diagnoses that you had rendered about Carly, and we left off, you were talking about manipulative behavior. Were there any other diagnoses that you attributed to Carly?
Yes, I didn't finish my thoughts on the psychopathic traits. There's a few other characteristics I'd like to just say real quickly.
Sure.
About the manipulative behavior, I found one example. There's others, but I thought, her journal that talked about the emotional manipulation and the happy hurting, I thought that was, concerning. She describes herself in the journal as melodramatic, and she asked herself at one point, am I just pretending just so my friends will feel obligated to comfort and care for me? About her emotional state, I thought that was manipulative. I thought about the fact that she didn't tell some of her, like LPC Kirk, about some of her marijuana use and such. I thought that was hiding and manipulative. And then when we were talking, sometimes she kind of de-emphasized certain things, and I kind of felt like I was being, pushed, not pushed towards a certain diagnosis, or I thought it was manipulative. So that's where I got that. Another psychopathic trait is like poor behavioral control. So I looked through a lot of things. I mean, obviously, the incident is a poor behavioral control, and doing the there's other things. The knife incident with the school, where she initially said it was for somebody told her to. She told me that a friend told her to bring it, but then after reviewing the discovery, it said that she had told them it was for protection, and mentioned some high school students. And then some promiscuous sexual behavior. There was a sex toy found at the scene. There was the nipple piercings. And so I'm certainly not diagnosing a 15-year-old as a psychopath. I'm just saying there are some concerning traits. And given me trying to rationalize why did this happen, that played a factor to some degree. And then lastly, I agreed with some other specified trauma and stress-related disorder, like an adjustment disorder with prolonged duration of more than 6 months without prolonged duration of the stressor, which basically adjustment disorder, which is a type of trauma-related disorder.
And considering all of those diagnoses, what was your final conclusion? We talked about it kind of in the beginning. I want to come back to it. Your final conclusion about whether or not Carly meets the standard of McNaughton insane in the state of Mississippi.
So all of those diagnoses gets me to consider McNaughton. So she's got the ticket, she meets the threshold to consider it. So I considered it, but her actions, for which I observed on the video and reading on the text messages and reading all the discovery and understanding what seems to be the context, in my opinion, her actions strongly demonstrate that she understood the nature, quality, and wrongfulness of her actions on that day, and therefore, in my opinion, the ultimate decision is for the fact finders, but my opinion is that she does not meet Mississippi's standard for insanity.
And is that opinion to a reasonable degree of medical certainty?
Yes, it is.
Attorney Witness, Your Honor.
Cross.
Thank you, Your Honor. Good afternoon, Dr. Pickett, or may it please the court?
Yes.
Good afternoon.
Good afternoon.
I have a few questions for you, I guess, regarding your report and everything that you've just testified.
Yes, sir.
First of all, I know you're a forensic psychiatrist, and I know I think you're qualified in emergency room technique, or as an emergency room doctor, as a psychiatrist and as a forensic psychiatrist.
Yes, sir.
My understanding is, when did you become a psychiatrist? I guess when you become a forensic, or when I say psychiatrist, a forensic psychiatrist, that's when you become board certified? Is that sort of, or do you just take the classes and then you get board certified?
So you complete your psychiatry residency first. You graduate from that. You get a degree that you're a psychiatrist, but at that time you're just a general psychiatrist. You still have to take whatever state boards to be licensed. Then you apply for a fellowship. It's a very competitive process. You get selected, and then you are a fellow. You're not on your own, but you are seeing forensic related cases under the supervision of your supervisor.
And when did you become, become an official board certified forensic psychologist or psychiatrist?
So I graduated from my fellowship in forensic psychiatry in June of 2023, and then I believe I took my boards around September. No, what was that? 20? Yeah. That would have been September 2023 when I got my board certification. But you're doing forensic cases, that would have started in July of 2022.
Okay, so you've been doing forensic cases since July of 22, which is approximately 2 years.
Approximately, yes, sir.
Okay, and you actually became board certified in, I guess you said October?
I'm estimating September of 2023.
Okay, so it'd be about a year from now, right around about a year. Okay.
Approximately, since I was board certified, yes, sir.
Okay, and you don't have a specialty in child or adolescent psychiatry, correct?
No, sir.
Okay. And wouldn't you agree that anytime you're dealing with kids, adolescents, there's little nuances and differences in those situations, correct?
I think there's certainly subtle, little, as you said, little nuances. But as a general psychiatrist, we do have experience with pediatric and adolescents. We do at least a year in our residency of exclusively child and adolescent. So we do get trained on it in residency. And as a general psychiatrist, you commonly can see whatever age you feel comfortable with. You don't have to be board certified to see it, is what I'm trying to say.
Not saying you don't. I guess my question is, I'm sort of getting into, there's an actual, I guess, board certification, which is for children and adolescents.
Yes, sir.
And so how many more years of school would you have to go to get to that point?
That's 2 years, I believe.
Okay. And that sort of, you get all the specialties and everything, so you know the nuances and how everything works. Is that correct?
I think they have more training in it. I agree with that.
And Dr. Clark, who you watched testify yesterday, he's board certified in children and adolescent psychiatry, correct?
According to what he said, yes, sir.
Yes. And are you doubting what Dr. Clark said about his qualifications?
No.
Okay. So he would have more, I guess, training and stuff in as far as, I guess, with children and adolescents, correct?
Yes, sir.
Okay. And he's also, I think, been practicing for, I think it was 25 or 30 years, correct?
I think that's what he said, yes, sir.
And so he would have a lot more experience than you do, because you're, I guess, where you're at for forensic psychiatry just started about a year ago. Would that be correct?
What part of that are you asking is correct? That my training was just a year ago, or that he has a lot more experience than me?
He has a lot more experience than you.
Yeah. Yes,
Okay.
sir.
And in fact, he's even taught psychiatry, correct?
That's what he said.
Okay. Now, Les, I want to go through this. It seems like, have you ever heard of the term confirmational bias?
To some degree, yeah.
Okay. And isn't it true that what confirmational bias is you get something in your head and then you go out and you start trying to prove it, as opposed to figuring out what the big picture is, you sort of narrow it down and you try to get a specific result. Would that be correct?
Yeah, I think that would be the definition of confirmation bias.
Now, do we have a little bit of confirmational bias in this situation?
Honestly, I do not believe so. I told the prosecutors that I'm going to be as objective as I can, but once I start reviewing discovery and learning about this case, depending on what those point me to, will determine my opinion. And once my opinion falls on the side, then I'm going to, advocate my opinion.
Well, there's some things that I guess where I and I'm not going to go through everything as far as your report and everything, because I'm not a psychiatrist, and you know a whole lot more about psychiatry than I can ever ask you questions about. But you would agree with me, Dr. Clark testified that he had diagnoses that were very different from the ones that you had today.
Yes, sir.
And you would also agree that Dr. Clark has a lot more experience, correct?
Yes, sir.
Okay. Now, there's some things that I wanted to go over, because you talked about, I guess, that there wasn't really anything that could be used that would lead you to believe that she was suffering from, I guess what Dr. Clark called wasn't delusional. What was it? What did he term it? What was her condition?
He said many things.
Yeah, wasn't it dissociative or something? What was it? What was he saying that she was suffering from?
I don't want to speak for Dr. Clark, but I believe he was saying something along the lines.
Dissociation, maybe?
Yeah.
Okay, is that what he was saying, that she was in a state of disassociation?
I think he said that.
Okay. And so you don't believe that, well, one, let me back up. You said you're not really familiar with that, correct?
I said I'm not the nation's leading expert on it, but we get trained on it in residency. I've read about it in the DSM-5 TR. I've read various articles about it preparing for this. So,
have you had people that have been under this affliction before?
Very few.
Very few. And it's not something that's common.
It's not.
And I think something that's important is you said this is a very unusual case. This is a rare case. Wouldn't you agree on that?
I think it's unusual for a 15-year-old to shoot and kill their mother. And it's unusual in that aspect. It is not unusual as far as the psychiatric diagnoses and mental health based on review of her records, in my opinion. That's actually very common.
So the situation is very unusual. You don't see this very often. And the fact pattern is really unusual in this, isn't it?
Can you elaborate a little bit on what you mean by fact pattern?
Did you ever see any violent tendencies at any time? Were you able, in your, I guess, review of everything, were you able to see any violent tendencies that she had? And I'm talking about Carly.
I'm simply trying to recall some of the journal entries. Some of them had negative themes, that I would say, and they idolized characters who were violent. And so did she have some predilection towards that, or based on her personal journal? Yes. But did I see any from her? No, I did not.
And the journal was what that you saw, that she talked about movies, different things like that? That's what that led you to believe that she has violent tendencies?
In her journals, she talks about happy hurting with her emotional manipulation. She talks about she really liked the Pinocchio movie, and her favorite parts were when the bomb dropped on the church that killed Carlo and Mussolini, and she referred to that she might one day be famous for making a nuclear bomb. Not that she had in plans to do that, and it's okay to be evil, and she chooses fire because it is powerful, beautiful, and deadly. So no, I did not see her do violent acts from the offense, but I did see a theme of concerning things, and many of them had violent themes.
And that's it. That what you just read off, that was it.
I do not believe that's it. That's what I could find as a needle in a haystack of an 85-page report, but there were themes of that.
Now, you said, you brought this up, and you said life's greatest, what is it, illusion is innocence?
Mm-hmm.
And you made a big deal of that, right? And you said that you thought that was, I don't say inappropriate, but her putting it in her journal caused you concern.
To some degree, yes, especially given the context of where we're at now.
Do you know where that comes from? It comes from a video game. That's it. It's a video game. It's called Skyrim.
Yeah.
No clue, did you? You had no clue that that's where it's coming from. Did you think she made it up?
I am familiar with the game Skyrim as a gamer myself. Her screen name was Lazy Assassin. That was her online screen name too. We're going to talk about video games and violence and Skyrim. And Skyrim is an adult game, and there are some things in there that I don't think are appropriate for a 14-year-old, but that's just my personal opinion.
And kids play that all the time, and I agree with you, there's probably things that are inappropriate. But that's the game. Did you not recognize it?
No.
Now, there's also, I think you would agree with me, that there's a lot of, in her journal, there's a lot of, I guess, quotes from songs or lyrics from songs and things like that. And that's all pretty benign, correct?
Yes, sir.
Now, the one thing, and this is where I get into this confrontational bias a little bit, every time there's something that points to a different position or for what Dr. Clark brings up, you say you're discounting the journal, that where she says that she's hearing voices and all this kind of stuff, and she's hearing voices before this incident. You're like, I'm going to discount that. That doesn't really count. But then you turn around and want to use stuff like this and say, yeah, I'm taking these little statements and it's violent tendencies. So why is it that you're sort of, how do you say, cherry picking the different parts of it that suit you?
I would have to disagree with that. I'm bring up a few highlights that are concerning to me. But also in my report, I mentioned that in her sketchbook, she has some sketches of little ponies. That wouldn't support that she's violent. That's included in my report. And also, some of the journal stuff is inconsistent in that she mentions, feeling numb and things like that in January in her journal. But then come February, she tells that to the nurse practitioner and they attribute it to her Zoloft. And so some of the things in her journal, are conflicting with what I'm hearing from other sources. So I don't put a whole lot into it. I'm certainly not basing my decision about her insanity on those things. But to even consider insanity, you have to have the prerequisite threshold diagnosis. And therefore, I did a deep dive into an adolescent's journal. But that was only one piece.
Now, the biggest thing that you said led you to believe that, caused you concern was that you were not seeing, I guess, any reporting from either of the two. I guess it's Kirk and the other therapist, and that caused you some concern because you were saying that normally, individuals are going to confide in that person. Would you agree?
Generally, most people would confide in their mental health professional about things that they were concerned about regarding their mental health.
Yeah, now we had some testimony from one of the therapists today, and she said that it had taken her, I guess, a year and a half before Carly had opened up about issues. And I think with these people that she started seeing in January, that would have only been about 3 months of seeing people, correct? So there wasn't a lot of history with therapists between, I guess, when she went in January 15th to when the incident happened. Would you agree on that?
I agree that there was only those 2 within that period, but there are older records from a therapist that were also reviewed in my report.
And she wasn't having these issues back then, or correct?
No, and that was actually closer to the traumatic event.
Now, are you sure that's the traumatic event? Because that's one of the things, you go to the traumatic event. You can have other things that cause you to have a traumatic event, correct?
You can.
Yeah. So when you're saying that there's a traumatic event in her life and it's whatever happened, it's 5 years ago, we really don't even know if that's what it was, correct?
We don't, but by talking to her and asking about her history, it does seem like when she's talking that was a significant trauma. The Kevin, the neglect, the abuse, and her sister dying at a young age, and her parents divorcing. Those were big, and she hasn't mentioned anything bigger than that to me, or that I have seen in the records.
Now, she was diagnosed with that. I guess it would be a major, I guess, psychological issue in January. Was that correct?
I believe LPC Kirk diagnosed her with adjustment disorder, with mixed anxiety and depressed mood, and the mental health nurse practitioner Lieber agreed with that, also diagnosed her with adjustment disorder, and said that she met criteria for a single episode of major depressive disorder.
Yes, and I want to say they, medication was prescribed, correct?
Yes, sir.
And it was never discontinued, correct?
No, sir.
And when I'm saying discontinued, I'm not trying to, play loose and fast with my question. It is, she's continued to have medication to this day since January of January of this year until currently, as far as you know, correct?
I know she had it up until the incident. I have heard some of the things that she's been on in jail or being detained. I don't know the specifics of all that.
Now, in jail, she was diagnosed with a psychological disorder and treated with high doses of antipsychotics, correct?
I would say it's a moderate dose. I think it's 10 of Abilify, Dr. Clark said. I mean, when I'm at the state hospital, now these are adults, I do go up much higher doses, 20 milligrams even, maybe even 30 at times. So 10 milligrams, adolescent, seems moderate. One of the current is, I believe she was on Celexa in jail. So Celexa, that one's a little concerning to me because Lexapro and Celexa has Lexapro in it, essentially, in a very basic term. Citalopram is 2 mirror images, the R citalopram and the S citalopram. They're mirror images. It gets into biochemistry, blah, blah, blah. But it has both in it. The Lexapro is just the S-citalopram portion. So to me, if you're really concerned that the medication was causing some issues, having her on citalopram, Celexa, which is still Lexapro, doesn't make a whole lot of sense to me. Now, the Abilify, we use that for many things. And that could explain some of the,
Well, and this is one thing, Dr. Clark had explained it yesterday. And he said that, yeah, your Celexa has the Lexapro, but it has the other, whatever the other qualities, and it affects the brain a little bit different. So some people that don't do well on Lexapro do well in Celexa. Would you agree on that?
I would recommend if somebody had reportedly a bad experience on Lexapro, then you shouldn't use the SSRI that is as close as possible to it and literally contains the same medicine. I think that would be a bad idea.
And so again, that's where you differ with Dr. Clark.
Yes, sir.
Okay. Let's talk about, I think you were talking about Dr. Hardy's evaluation of Kevin Gregg.
Yes, sir.
And that's a person you have never, ever seen. You have seen 3 pages of, was it medical records I think you testified to?
Yes, sir.
And you're wanting to basically say that the doctor that has seen him is wrong on his diagnosis, that actually saw him. I know you said it was only for a few hours according to the records. 1 hour for the records that you saw.
Total for all 3 visits was 1 hour.
And so you're saying that he got it wrong, and you don't know if there's even more medical records, do you?
I've asked for the other medical records. I wanted the other medical records because I really wanted to confirm or deny whether Mr. Kevin Gregg actually legitimately has one of these mental disorders or whether it's just substance abuse.
So the way I got it and the way your testimony was, and maybe I could be wrong, but it seemed like you were saying you don't want to say, or you, first of all, we were dealing with bipolar, and evidently there's a heredity issue with bipolar.
Yes, sir.
And so you were wanting to say that Kevin Gregg really doesn't have bipolar, therefore the heredity part of the prong that would go towards Carly doesn't exist.
I would say yes, if he doesn't legitimately have bipolar disorder, then it makes it less likely that Carly has it.
And so your reasoning is that you want to make another diagnosis over a doctor that actually saw the individual and diagnosed them with bipolar.
I don't want to, but as my job entails, I have to look at the details. And people are misdiagnosed frequently. I know this because I work at the state hospital and these patients come to me and reportedly they have a diagnosis of this or that, and we kind of go through their history and we're like, no, it actually seems more consistent with this. So it is standard to question previous doctors on their records, especially when they're so sparse, especially when there's a big history of drug abuse that can make you look manic, that can make you look psychotic. I wouldn't be doing my job if I just accepted any piece of paper that says somebody has a diagnosis.
So even though there is a diagnosis, a valid diagnosis from a doctor, and you don't have anything to overturn it, you're like, I'm not accepting it. It's basically my understanding.
I disagree with the diagnosis based on extensive review of Mr. Kevin Gregg per all the records, Ashley's description of him, Carly's description of him, grandparents' description of him to the deputy as I was watching the video. Anybody that knew him knew he was addicted to many substances, and he was prescribed Adderall, Klonopin, and Ambien. If I have somebody with bipolar disorder, I'm not going to prescribe them Adderall because that can really push them into a manic episode. And when I reviewed Dr. Hardy's records, he did not justify. If I have a patient that comes to me and this is our first interview, I will say, according to the records I've reviewed, Mr. Johnny has schizophrenia because he had delusional thoughts, he had disorganized thinking, he had auditory hallucinations, and here's the records I based that off of. And Dr. Hardy did not do any of that. And actually, his substance abuse was minimized in those records. And so I just don't believe that Kevin may have been as forthcoming with Dr. Hardy, and he may not have had all the records.
Now, what is Thorazine?
It's an antipsychotic.
And that would be something that that was prescribed to Kevin Gregg by Dr. Hardy.
I don't know everything Dr. Hardy may have prescribed him. I know the ones that were very concerning.
And you didn't see that one? You didn't see that?
I don't remember.
What about, I guess it's Respira?
Risperdal.
Yeah, what's that?
That's an antipsychotic.
Okay, that was prescribed to Kevin Gregg by Dr. Hardy, which would be consistent with what's that treating?
We use antipsychotics for behavior. So if somebody comes in and they are acting erratic, violent, aggressive, yelling, screaming, throwing fits, hurting people, we often use mood stabilizers and antipsychotics. So just because somebody's on an antipsychotic does not mean they have a psychotic illness or bipolar disorder.
Now, did you never looked at the medical records from the jail, correct?
I looked at the ones that were sent to me from Region 8, and I glanced over them. I didn't necessarily put a lot of weight on them, only because I am evaluating her sanity at the time of the offense. And what she says to people now that cannot be objectively confirmed, I can't see it and do it in myself and really see that I see this without such giant secondary gain. I'm real skeptical of those things, and so I didn't put a lot of weight into them.
Because the way I understand it is, she gets diagnosed in January with, I think, with a major situation, however you want to call it. It was a one-time kind of deal.
Yes, sir.
And then you were in here when one of the witnesses disclosed that Carly and her talked about Carly hearing voices. Remember that?
I do.
Okay. And so that happened before the situation happened on the 19th. And then you had, in the journal, it talked about hearing voices. And I think that was on the 12th of March, which was right before the situation, correct?
Well, a few things I'm skeptical about is the friend. I believe they're still friends, is what was said yesterday, and that they still communicate to some degree, and sometimes ideas can be implanted after the fact and people don't know. So I'm real skeptical of that because of the large secondary gain and the things that have been consistent with malingering. The journal article for the 12th, when I see people that have schizophrenia and they are suffering with these auditory hallucinations that they do not want, they do not like, that bother them, they usually do not describe them as quite silly, and they do not describe them as ravenously screaming at each other, and thankfully physical altercation is not fruitful. That's not how they describe it.
How would a 14-year-old describe it?
I think she would go to her mother and say, "Mom, I'm hearing voices." And the mother, especially if she was as involved as Ashley, would have taken her and made sure that the mental health providers knew about it.
Well, I think all the testimony is that she didn't want her mother to know about that, correct? Isn't that what all the testimony is?
I have heard all of the testimony. I've heard the last 2 days.
I mean, you've been for the last 2 days. I think the testimony has been, especially you heard everything that Dr. Clark said. Everything was that the mother did not want to, or Carly didn't want the mother to know about her I guess, issues. I think you even talked to her in jail about this very thing, didn't you?
I never talked to her in jail. I talked to her here in the courtroom doing my evaluation.
I'm
she
sorry,
did
it's,
talk.
It's connected.
Okay, my impression was that she wanted to hide especially some of the more negative things from her mother, the burner phone, the marijuana, talking to the boy. It's not my impression that she was trying to hide her mental health from her mom. I think her mother, from everything I could gather, was very aware of her mental health, and therefore her mother insisted on taking her to seek help.
Now, you did bring up a good point, and you brought it up a couple times, the individual, like clients, patients, however you want to characterize it, a lot of times they're not forthcoming with everything to people like psychiatrists, psychologists, individuals that are therapists, people like that, correct?
Yes, sir.
And I think you heard from one of her therapists today that she was having to drag stuff out, that she was almost about to, say, hey, we need to switch to another person because I'm not getting a lot of, I'm not pulling stuff out of you. I'm not helping a whole bunch. Do you remember that?
My impression was that Dr. Kirk thought that she was doing fairly well and was considering discharging her, or referring her elsewhere if necessary, but at that last visit, pried her, kind of pushed to talk about the stuff with her mother, and that's when the rage and the anger came up.
Now, at one point, Carly, and this is stuff, again, put in her journal, and said that she had a psychological or psychotic break. Do you remember that part in the journal?
Yes, sir.
And you said you didn't put a lot of credence into it because it was something that she wrote, and I think you said the journal was, she was using it as sort of like theatrical and things of that nature. Is that sort of your take on it?
Yeah, I said there's a mixture, seems like, of what might be truth and what seems theatrical.
Now, the disassociation, which we were just talking about, you're not really, you said you know about it, but you're not an expert, and you said you have seen it in rare cases. We agreed that this was a rare case, correct? Or your words, I can't remember.
It's an unusual case in that a 14-year-old killed her mother. It's not unusual in that her mental health, as well as anxiety and depression, those are common.
And Dr. Clark had gone through and spelled out exactly how disassociation works and how it could work with her, how it was working that on the 19th, correct?
Yes, and I enjoyed the academic exercise of talking about dissociative spells, but in my opinion, what Carly did that day was not consistent with dissociative spells at all because of so much specific intent.
And just getting into the specific intent that you're talking about, if you're in the dissociative, situation, you wouldn't be knowing what you're doing with all that. You can be doing that, and I think the research shows that you can do that, correct?
I think the literature is very sparse on this. I think the literature talks, there are case reports or examples of violence being completed in a dissociative state, but again, based on my review of the video and Carly's text messages at the time, it, in my opinion, shows way too much intentional, high-level executive functioning to be in this unknown dissociative spell and yet do so many specific things.
Right, and it sort of goes back, you're talking about, I think what the literature says is that happens. It's rare. This is a rare case to begin with. And then you have more, rarity in a lot of the facts. So, I mean, it's possible that happened, correct?
It's in the realm of possibility.
Yes.
But I have to say that what's a lot more common and the literature supports is arguably the most commonly malingered thing is malingering amnesia, particularly after homicide. And that's much more common than what you might be able to possibly do in a rare dissociative state.
Right, and that's where you go back in and you start looking at sort of different things that had happened, as far as you're looking in the journals, you're talking to the friends, you're seeing things like that. One thing that on the jail records that was very important was it showed that she had said that she was having hallucinations. I think more than, I think she did that in at least a couple months, and they gave her a Abilify. I think you remember that.
Were they visual or auditory hallucinations?
Auditory hallucinations, I believe. Yeah, auditory hallucinations.
That she reports.
She reports to the medical staff at the jail. They give her a Abilify, and then after a few months, it gets better.
That's all per Carly.
Yeah, but that would also be consistent, that because you can have a I guess a episode, a psychiatric episode, and it doesn't all start at one time. It builds, correct?
Cases vary. Some people, it shows subtly and then progresses. Other people may do a substance and then it causes a break or something like that. So it can vary.
It can vary, and you can, in this situation, there was stuff that was out there before this happened. And then we have the 19th of March, and that's when this situation happens. And then right on the back end is where you have, I guess, she's telling the person in jail, this is what's going on, and they prescribe her this medication, and then it gets better. Did you talk to her about that, about the hallucinations no longer being present?
I don't remember us getting into that too much. Sometimes I try not to interject or implant. I don't want to say, hey, are you having this? Are you having that? I want them to voluntarily tell me, because I don't want to implant ideas in people's heads. And so most of the time, if they're really experiencing these things, when I see my patients with schizophrenia at the hospital, they gladly tell me and eagerly tell me and beg for me to help them.
Well, you keep saying when you see your clients at the hospital who have schizophrenia, you didn't diagnose her with schizophrenia, correct?
No, sir. I'm just using schizophrenia as a standard psychotic illness.
Well, when you saw her, I guess it was on the 30th of August, not too long ago.
Yes, sir.
She's competent. She answered all your questions, all that kind of stuff. There wasn't any problems, correct?
Correct.
She's lucid. I mean, she was on the 30th. She was 100% fine.
Yes, sir.
The big question is how she was back on the 19th of March, correct? That's what you're here for.
Yes, sir.
And so right after that, there's records at the jail where she's saying she's having these hallucinations. They're giving her medications. And then it seems that works, because she no longer, I think there's some notes that she's no longer having them. So wouldn't that be something that you would want to look at?
It's not necessarily pertinent to how her mind frame was at the time that she killed her mother, especially when I have video footage of her at that time, and I have text messages of her conversations at that time. I know I have all the statements of everybody who knows her way better than me. I have medical records from years. Hearing exactly what she says afterwards, when there's a big secondary gain.
Well, what about the victim in the case, her stepfather? Her stepfather describes her as, that's not Carly. That's what his testimony was. And he's the person that actually saw her. And I know you haven't said anything about that, and that would seem that would be something that's very, very important when he's saying she was not in her right mind. And that's when it's happening.
I tried to call him and interview him, and he didn't want to talk to me. But later he called me for about 6 minutes on the phone at the request of Attorney Todd, and we talked, but it was very limited to she's Carly's been forgetting things and zoning out. I wanted to talk to him and hear his side.
Did you not hear the testimony?
I didn't hear his. I was only here for yesterday and today's.
Okay. Because he said that, would this have any impact, is if he's saying that she did not look like she knew who he was.
Well, she called his name 3 times when she knew he was coming home, and she texted him and said, "Hey, when are you coming home?" So I find it hard to believe that she didn't know who he was. Now, him being in a shocked state, looking in her eyes, if she's in a shocked state too, because she's about to shoot him or attempting, I don't know how much he could decipher accurately at that time.
So his opinion on her state and how she looked and things like that really doesn't play with you very well.
I would take it into consideration. I do not think it would change my opinion.
And I mean, I just so the jury knows, there's nothing that I can say up here when I'm asking you questions that's going to change your opinion, correct?
If you were to give me some objective evidence of things, I would certainly take that into consideration.
You wouldn't just go like what we did with he's Smiley and just say, I don't think that he can make a good determination.
No, I've based my opinion off of the mountain of evidence that I have reviewed, my clinical evaluation of 4.5 hours with Miss Carly, reviewing all the medical records. I have based my opinion on that, and if there was new information that was relevant, I would certainly consider it.
May I beg the court's indulgence?
Yes.
I know you're a psychiatrist, forensic psychiatrist. Did you treat many kids at all?
Not as a general psychiatrist, not as a forensic psychiatrist. As an emergency physician, I frequently treat kids.
And just dealing with, I guess, your role as a forensic psychiatrist in this situation, how many evaluations on adolescents and kids have you done?
As a forensic psychiatrist,
Yes.
probably my first.
Okay. How many times have you been qualified as an expert to come in and give opinions?
I did have to testify in another case on a patient who was bipolar, and the ex-wife was trying to say just because he has bipolar he couldn't see his kids, and I said he's doing great, he's taking his med, he could just see his kid. I was an expert in that. It wasn't, it was mental health in the legal system, so I think that would qualify, but that's my only other time.
Okay, so this is your first time in a criminal case.
Yes, sir.
Okay. And this is your first time doing an evaluation on a 14-year-old.
I'd like to clarify my last answer. This is my first time testifying in a criminal case. I have done competency evaluations and sanity evaluations for patients regarding criminal cases. I just haven't testified in those cases.
Gotcha. Have you done many evaluations of children and adolescents?
No, sir.
Okay. And this is one thing. There were 2 other evaluations that were done, and that's Dr. Clark and I think Giuliano.
Yeah.
Okay. Neither one of them came to the conclusion that there was malingering, correct?
Not that I recall.
Okay. We would tender, Your Honor.
Where do
Dr. Pickett, you've done more than, or close to over 100 evaluations regarding competency and insanity, isn't that right?
Yes, ma'am.
Mr. Camp asked you about if Dr. Clark had more experience than you. I guess that means he's been practicing longer.
I guess.
I submit to you, there's attorneys that are quite older than I am and have practiced a lot longer than I have that have been disbarred. Does more experience always mean that you're a better doctor?
Not necessarily.
Does more experience mean that you always get the diagnoses right?
No, and I would like to just clarify quickly, even if she has all of these diagnoses, what matters is that just lets you start to consider insanity, even if she has all of them. And I'm completely wrong about all my diagnoses, and she has all the diagnoses that Dr. Clark says. In my opinion, based on reviewing the video footage, the text messages, the extensive discovery review, her actions at the time strongly suggest that she understood the nature, the quality, and the wrongfulness of what she was doing.
And just one more follow-up, Dr. Pickett, to that. Mr. Camp mentioned that when you evaluated the defendant, I think he said that she was competent and 100% fine. But she actually was claiming to you that at that very moment she was in one of these disassociated spells, right?
Yes.
No further questions, Your Honor.
State have any further witnesses?
The state rests.
All right. This witness may be released by the state, correct?
Yes, sir.
By the defense.
Yes, Your Honor.
All right, you can stand down. And the state finally rests, correct?
That's correct.
All right. Ladies and gentlemen of the jury, it's 5:05. I'd ask y'all to be back in the jury room 8:45 tomorrow, ready to go, okay? Everyone remain seated while the jury exits.